start. So thank you for coming this morning. I have some guests with me who I'm going to introduce to you. I have Cindy Zimmer, Crystal Kenzie. Their mother is Susan Becker, and I have Alex Pazder, pardon me, and Eric Pazder. And so they came today in support of the Mental Health Amendment Act of 2024, which is a private member's bill that I introduced today in the BC Legislature. It actually builds on the Mental Health Amendment Act 2023, which I introduced last year. That bill as well was inspired by suicides that occurred in British Columbia and the loss of life. Last year's bill, which was not called by the NDP, addressed shortcomings in Section 28, which is emergency apprehensions, asking and actually making it a requirement that doctors and nurse practitioners seek collateral information from close relatives. So the year basically in between that private member's bill and this new 2024 bill, I met with numerous families, very sadly, who've lost loved ones to suicide or have had family members self-harm. And families actually are the ones that help point out some of the other shortcomings of our Mental Health Act, and particularly where it comes to informing families, making sure that families are in the loop on the care of their loved ones. In British Columbia, everybody knows that we are in a public health crisis, that we rely heavily upon families and close relatives to provide support for their loved ones, not just with mental health and addictions, but actually with many healthcare issues. But we need to recognize that, in wanting families to be part of the care of their loved ones in communities, we need to do a better job of making them part of the care team. And part of that comes from being able to have those conversations when they're needed. And so these amendments that I'm introducing this year in the 2024 Mental Health Amendment Act will address those shortcomings. So continuing on Section 28, that information sharing in the emergency room, and then Section 34 actually makes a change from families being advised that their loved one is released from involuntary care. Right now it says after they're already released. We want to change that to be prior to their release. Additionally, there's been many circumstances where a person is released, sadly either self-injures or dies by suicide, and their families weren't told that the person was even released from the hospital. So we also want to make it a requirement that if a patient withdraws the consent for that information to be shared with a close relative, that close relative who had previously been receiving that information is told, that they're told that they won't be getting that information anymore, so that they can either make their own arrangements or have a larger conversation then with the healthcare team, and that it be properly documented, a requirement to be properly documented on that patient's medical record. So, these are, just like last year, we're very passionate, obviously, about these issues because they deal with real people. And a significant loss of life in the BC Legislature. I gave a statement yesterday on mental illness and spoke to the fact that in British Columbia, around 600 people lose their lives to suicide every year. There's lots that we can do about that to make things better and to support families. So I'm going to invite my guests to speak to you now. Cindy?
Thank you. Thank you, Eleanor. I unfortunately join these family members here today who have also lost a loved one to suicide. My sister Crystal and I we have been trying to express our concerns. We've actually had meetings with the Minister of Health and the Minister of Mental Health and Addictions to raise these concerns. Our brother, James Zimmer, was let go from the hospital, and it was clear that we were to be notified. It was agreed upon, but we weren't notified.
And we believe that if this amendment to the Mental Health Act is made, if it was already made, our brother could still be here. We've been fighting for the last year to advocate for this kind of a change so that our new friends here who we wish we didn't meet this way would still have their brother. It's unacceptable and it needs to change.
And during one of our meetings, it was a meeting that we had with Minister of Health. He had asked, would it be better if, maybe it was a notification that the consent was withdrawn. So it was interesting because during that meeting, it was an idea that he had actually expressed to us. So I actually think that this is, if there's, privacy laws and the freedom of information that is getting in the way of safeguards and protecting individuals so that they don't fall through the cracks, at least if a family member knows that that loved one has withdrawn their consent,
And that's a red flag that you can respond to.
you can show up and, know that you're not gonna get that notice.
If someone's at danger for hurting someone else, we don't allow that, but you can be dangerous, ending your own life, and it's fine, there's the door, and that's how they're treating it, and people are dying because of it, and families are being left without the opportunity to support their loved ones in their most vulnerable moments.
Do you have any sense about where the holdup is here? Like you described what sounds like a relatively positive conversation with Minister Dix. Clearly there's an issue here. What is your sense about why this change hasn't been implemented yet?
I'd actually really like to ask Minister of Health, Adrian Dix, and Minister of Mental Health and Addictions, Jennifer Whiteside, what that holdup is, because I don't see any reason why something like this, it's an amendment. They even expressed that, that the act itself is open to a lot of ambiguities. Like there needs to be a little bit more direct, clear language to safeguard individuals who are in suicidal crisis.
And in fact, we've been asking those questions and in person and through letters, and we still haven't had a clear response. So that is something that we're still waiting to hear on.
And Eleanor, for you, like, what's the sense you get about, why there's been so much difficulty getting government to move on this? Because I know this is something that's come up before, and there seems to be a resistance.
Well, I agree with Cindy and Crystal. I mean, this is a question for the Minister of Health and the Minister of Mental Health and Addictions. And as far as we're concerned, there is no good reason to not look at these amendments. And even the Mental Health Amendment Act of 2023 had things that could have easily been implemented. We're talking about not every medical circumstance. This isn't to disclose to family members a variety of medical issues. This is very, very specific to issues that are related to life-threatening mental illness. So people who have suicidal ideations, people who have even previously attempted suicide, self-harm, people who may be at risk of serious deterioration or harm to others. These are only a very narrow scope of circumstances under which these type of things could apply. And we are in the middle of a crisis of healthcare. A lot of people refer to a mental health crisis, a crisis of untreated mental illness. We rely very heavily on families to support their loved one in the community, either living in the same residence or living in a community residence. So why are we impeding families in their ability to support the person? The reality is that each of these people is an expert in living with their loved one. They have lifelong experience in knowing the person who's in crisis. They have a wealth of information to provide to their loved one's care team to help, and they want to help. And so there is really no good reason in my mind not to allow them to help. And for people that are worried, well, what if it's an abuser? There's lots of what ifs. Exactly, what if? Well, we can work through these issues. We can develop protocols that protect people who may be at risk. But for the vast majority of circumstances that I've encountered, both as a police officer in my previous role, and here as the critic for mental health and addictions, the vast majority of circumstances are like these, where we have family members providing care who just want to be able to provide input into the care of their loved one, and they have very reasonable and valuable information that they should be allowed to be sharing.
Ellen, Councillor, I was just going to ask, do I understand correctly this bill is sort of threefold? It would require notification of family member if they get certified, notification if they're released from the hospital, as well as notification if there's a change in that.
So Section 34 of the Mental Health Act already has provisions in it that say that a close relative should be notified if a person is in involuntary care. But currently it also says that if a person is released from involuntary care, that the family or the close relative will be notified after they're released. But in circumstances like what happened with James Zimmer, it is too late. And particularly, look, if we're talking about mental illness, even if the person is released from involuntary care, they haven't necessarily been cured of their mental illness. Things like traumatic brain injuries, schizophrenia, they need ongoing continued support. And so by providing the notification before the person is out, it allows for families to make plans to ensure that there's proper supports. Maybe there's medications to pick up and help the person. Lots of things that, families already are providing. We just need to make sure that we're empowering them to continue to do that and let them have, some participation. Of course, there's circumstances where people, they may withdraw that consent. And you know what? They would be free to do that. But we think it's important also to create a sort of, a mechanism that ensures that if you've been regularly receiving information, as in the case of the Zimmers and Crystal Kenzie, that they get notified that there's been a change because they thought that their brother was safe. They actually thought he was in the hospital until the police knocked on the door.
I'm sorry for your loss. And in your instance, was it a case that your brother had changed his wishes about you being notified, or how did it happen that he was released and you didn't know, but yet you expected to be notified?
Previously, when I had brought him into the hospital, it was a verbal expression that if there was any plans to be discharged, that he had agreed for me to be notified. This was a readmission after being, there's kind of a longer history to that I won't go into. Bottom line was that I had every reason to believe that I would receive a call. It was confirmed both by the physician and my brother, and that call didn't happen. It was after the fact that I found out that he had basically resyndicated his agreement to that. They said that's what he said. He had always allowed me to show up for him, and I just didn't get that opportunity. And this last year, Crystal and I have been working really hard to try and not have this happen to anybody else. And it's absolutely devastating to us to hear that less than 2 months ago, Alex and Eric here have lost a loved one, have lost their brother in the same way. And we really wanted to see these changes happen, and so that this didn't happen to anybody else. And I feel like this bill can be a little step towards some safeguards. So hopefully this doesn't happen to anybody else.
Alex, Eric, did you want to speak?
We lost our brother earlier this year in February. He suffered from schizophrenia and later in his life, drug addiction. He arrived at the hospital in the back of an ambulance. While he was there, we were trying to be in constant communication with his care staff. We tried to be there for him and help provide information regarding his background. Most of the time when we were talking to staff there, we kept getting somebody new each time. Some of them were not up to date. They did not know about his schizophrenia. And when he revoked his sharing, when he revoked his consent to share his medical information, the only notification we got was stonewall. We could no longer communicate with his team. We could no longer get information regarding his well-being. When he was sent back to us, there was no plan in place. We were not able to get any information regarding how he was supposed to get his medicine, how his aftercare solutions would work, how his blood work would work. We did not have access to this. We had to rely on him to communicate that to us, and he was not a reliable source. If we had notification, if we had medical staff interacting with us as a family, James might still be alive today. If they had been able to converse with us, if they had been able to listen to our side of things, then maybe things would be different. But things are not different. He was released from the hospital. Within a week, he had died by suicide. And there's a lot of stigma surrounding schizophrenia and drug addiction. It can cause somebody to shut down their communication channels. It can make it very difficult for them to interact and talk to people around them about their illness and their struggles. When somebody revokes consent, that should send off a red flag. People should be aware that somebody is struggling. We should have families involved in care. We do know them best. We have been there. It is unfair to expect medical professionals who might be trying, who do care about their patients, to look into somebody over the course of 10 minutes, 30 minutes, and try and determine whether or not they are well, without talking to their families, without talking to other people who know them, and possibly releasing them to harm themselves. We need to stop these tragedies. Something has to change. People are dying, family members are dying, friends are dying, and this is a step in the right direction.
Any other questions?
Yeah, this is a question for Emily Sturko. I've spoken to some of the members of the Pastor family previously about James Pastor's story. And one of the issues that came up and kept coming up in conversation was the difficulty that the family was having in finding James treatment for both mental health issues and for addiction issues, particularly on Vancouver Island. And there was a facility called Redfish Healing Center on the mainland that he was trying to get on a wait list for. What can we do to better serve people who have these co-occurring problems?
So the Redfish Healing Center, which was an initiative started by the previous government, completed under the current government, is actually a very good model. I've taken a tour of it. The problem is that it's too small and that it doesn't exist in every health authority as it should. People across the province need access to these types of programs that treat concurrent mental health and addictions issues. Part of our Better as Possible plan, which is the BC United plan for mental health and addictions, and if we form the next government, we have a commitment to expand Redfish Healing Center and to provide these type of centers in every health authority. We want people to be able to get treatment close to home, to be supported close to where they're from. And the reality is, particularly when we're dealing with a complex mental health and addictions issue as it relates to family. Families, they're not able to always travel to the Lower Mainland if you're from the island, if you're from Northern Health, if you're from Interior Health, and having to send a loved one with a serious mental health and addictions issue over to the Lower Mainland to attend Redfish Healing Center actually places that little bit of barrier then that the family has even further to help and support their loved one in their recovery. So we think it's a really important thing that we would expand that. It is a good program. too small, of course, and you know, the reality is that we need people to be able to stay longer, and that, you know, we shouldn't have to have people waiting for a long time even just to get on a waiting list for something that they desperately need.
Is this a matter of money and resources being put towards this as well?
Yeah, I would say, you know, this is the thing, we have a government that, in my opinion, has focused on a single pillar, you know, with our addiction and mental health crisis. They have focused solely on harm reduction, and have not expanded to the extent this province needs addiction services, detox, mental health of all varieties, both people who require bed-based treatments or long-term supportive housing, and even outpatient treatments. And so yeah, it's also to do with financial barriers. There's actually private facilities that can help with addictions, there's mental health facilities, but there's barriers, financial barriers. If you're a person who receives income assistance, you'll have a likelihood you can go because it will be covered for you. If you're super wealthy, then pay for where you want to go. But for those people, the majority of people in British Columbia who earn too much to qualify for subsidized care, not enough to be able to pay out of pocket for privatized addictions treatment, there's a barrier. So we need to make sure, just like we promised to be better as possible, to remove the financial barrier and provide treatment for those who need it in British Columbia free of charge.
This is a private member's bill, for how important it is, how likely do you think it is that it will get passed?
Unlikely. I feel that this government is unlikely, even faced with families who have lost loved ones, even having met with, you know, Cindy and Crystal face to face to understand what the issues are, and they haven't acted. I don't feel confident they'll bring it forward, but you know what? We still press ahead, and I've, you know, the families know that there's very slim likelihood that they will, you know, call this bill for debate. But we want to raise awareness. We want to make sure that families in British Columbia who have a loved one who's living with mental illness know that we hear them, and that there are other families out there for support. Connect to Protect is an organization that is advocating for strengthening these kind of ties between family and healthcare. And you know, we want to keep on championing this cause, especially in light of the fact that 600 British Columbians a year die by suicide, and there is significant things that we can do.